Welcome to the April 2025 free mini webinar, which is monthly, the third Wednesday of every month, unless something unusual is happening. And this month, we're going to be talking about quickie pain relief, and it is going to be quick, and I'm going to move kind of fast. I do love you to have input, and if you have something to share, please raise your hand or wave at me or do something, or just jump in. And that will be fine, because I'm going to try to cover a lot. And my goal is always to give you more than we have time to go completely over in here, and give you some ideas for resources that you can maybe explore some other avenues after we're finished about whatever might interest you. So what I'd like to hear, again, I'm Patti Scott, and I have Up Hypnosis Institute. I've been board certified medical and clinical hypnotherapist and a whole bunch of other things for 33 plus years now, and studying it another 20 something before that. So I love this field. It's my life. It's not my job, it's my life. So I'd like to hear from all of you, your name, where you're coming to us from, and just, again, whether you're a hypnotist, hypnotherapist, or something else. And why don't we start with Barbara?
Sure. My name is Barbara Austin. I am coming to you from Gilbert, Arizona.
Oh.
And I am a hypnotherapist, graduate of SWIHA, mentored by Linda Bennett.
Linda Bennett, lucky you.
Yeah.
Nice lady. Very, very
wonderful.
Good. Okay, Colleen, you want to go next? I'm just going by whoever I see here.
Okay, my name's Colleen. I live in Overland Park, Kansas, which is a suburb of Kansas City. I am a licensed professional counselor in the states of Kansas and Missouri. And I became a hypnotherapist, I think 2 or 3 years ago, and I use it particularly with PTSD trauma clients, particularly complex childhood trauma. And I'm interested in the medical piece because a lot of those trauma people have somatic symptoms, fibromyalgia, things like that.
Everything affects everything, doesn't it?
Yeah. Yes.
I say it all the time. I'm so happy you're here, and I'd love to get to know you more when we have some time to do that. Maybe after. Thank you. Welcome. Evelyn.
Well, hi.
Hi.
My name is Evelyn Ojeda. I live in Largo, Florida. I studied with Patti, I don't know how many years ago, Patti.
Been a while.
Yes, been a while. Yes. And so I'm a hypnotherapist. I specialize in working with mothers. So women who experience childbirth trauma, mothers in it's called matrescence, the first few years of motherhood, stress, anxiety, all of those things, parenting. So that's what I do, and I just love it.
Very nice. And that's a specialization that not a lot of hypnotherapists are doing. So thank you for doing that. Anne, I think I know who Anne is. You want to just say hello?
Yeah, I live in Palm Harbor, Florida, and I join occasionally just because I want to learn new things. So just an interested party.
That's why I'm here. That's why I'm here, learning new things. Yay. Michael.
Oh, yes. Hi. It's, yes, Michael and Diana Stern. We're in Palm Bay, Florida. Longtime interest in hypnosis, and we've heard and seen and talked to Patti before, not only on Zoom but in person, and always enjoy your presentations. And Patti, we're looking forward to tonight's. We're definitely glad to be here.
Great. And maybe I'll see some of you in May at the conference in Orlando.
Okay.
Expo. We'll talk about that in a minute a little bit more. Sure. Tony.
Hi, I'm Tony from Olivia, Minnesota, and I became certified by Jessica Hansen. Yeah, I know. I love Jess. My background was graphic design, and then I'm certified in energy work, Reiki, shamanism, and felt that piece that was missing was that subconscious when I deal with clients, helping them change that. So that's me.
Yeah, you don't want to leave that part out.
Yeah.
That's where all the good stuff happens. Right?
True.
Good for you. I'm so glad to see you again. Karen, you want to introduce yourself?
Sure. Hi, I'm Karen. I'm a holistic practitioner and a somatic intuitive trainer and certified mind body integrative specialist. I'm also a certified hypnotist. I was trained through the Elman Institute.
Beautiful. Where are you located?
I'm nomadic. I'm currently in Canada, but I lived in Phoenix for 15 years and I'm quite familiar with the Swiha.
Very nice. Jan. How
Hey,
could I forget Jan?
I'm Jan. I live in Loxahatchee, Florida, which is right outside of West Palm Beach. Um, I'm certified in hypnotherapy and stress management consulting, also an integrative life coach, and do Reiki and chakra balancing. And I'm going to the conference in May, so I'm looking forward to that. And it's an amazing group. Amazing group. Glad to be here.
I'm glad you're here. Valeria.
Hi, I'm Valeria Basso. I'm in Chicago. I'm a certified hypnotherapist and certified stress management consultant. Primarily, I use hypnotherapy. I work with women to help them get clear on their path, heal their emotional blocks, especially self-worth, self-confidence, inner conflicts. I haven't used it so far much when it comes to pain relief, pain management. So I'm interested in this talk today.
Oh, good. Then I'm glad you're here. This will be the starting point. Hopefully, you can take off on it. I don't know why it doesn't just let them in. Just let them in. Let everybody in. Come on. Okay, Ray, you just missed the introductions, but you're just in time. We just finished, so you're going to get to introduce yourself.
Okay, Ray Miramontes from San Diego, and I am a clinical hypnotherapist, also a certified medical hypnotherapist that I received my training from Patti, which was very incredible and very fantastic. And that is me.
Thank you for showing up. He's been helping me out here lately with my current class that I have going on hypnosis. So thank you for that.
You're
Let's
welcome.
get going here. This is going to be quick. And this is also considered a IACT, IMDHA, and HEA, which is Hypnosis Education Association chapter meeting. I do a real quick meeting. Nowadays I'm editing that part out for the video, for the YouTube videos. So enough with that. Let's get going on pain. I'm going to start out by doing a little bit of an overview here, a little thing that I put together so that I can stay on point and cover a lot. Like I said, in this short amount of time, only cover so much, but this is going to be about QUICKIE pain relief. I know a lot of you are already working with pain. Some of you may be very expert at it, and I would love your input, like I said, or questions throughout this whole thing. If you want to jump in, that's fine. I don't know if you're aware of this, but there's a new definition for pain that they came up with in 2020. And this is taken from IASP-pain.org. The old 79 definition, the last time they defined it, they said it was an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. They revised it in 2020 because we are evolving, thankfully, in these fields. And the new definition says it's an unpleasant sensory and emotional experience, same so far, associated with or resembling that associated with actual or potential tissue damage. That was a big change. It looks small on print. It was a big one because they started to realize pain is not necessarily associated with tissue damage. And part of this came out of all the great brain imaging machines that they have nowadays and all the different research that's been done on pain. And that associated with or resembling that associated with, that was added to allow for an expanded understanding and appreciation of pain beyond what was previously limited to actual tissue damage, as I said. And there's a lot you can expand on that. I'm going to give you an article if you want me to mail it to you. And I'll also show you where you can look it up online in a little bit that has some great in-depth that we don't have time to get into here about that very thing. Above all, pain is subjective. This is something they didn't used to think. They thought it was either tissue damage or it was all in your mind. I mean, it wasn't all that long ago. I can remember 33 years ago when I started in the medical hypnotherapy field, they used to tell people, I mean, they didn't even know what things like fibromyalgia were yet really back then. And they would tell women, especially with that kind of thing, you're just imagining it, it's all in your mind. They didn't know what to do with it. They didn't know how to diagnose it. So pain is now they know, thankfully, it's very subjective. So each individual, if they come in with a migraine type issue with me, I clear my brain and I don't apply it to anything I know about migraines until I hear what is their experience. What does it mean to them? How did they experience it? This is what the newer wave of hypnotherapy is about. It's about client-centered. Each client is unique and special. And that's where I think hypnotherapists have been ahead of a lot of the other helping fields, because I think most of us have always dealt with it that way. So I have an article that I can send you. It's quite old now, but it's still relevant. And it's called Pain is a Behavior. So they're starting to really realize the connection between the brain, the body, the mind, all of that. And it's a very real sensation of pain that is created even when there is a tissue damage. It's a signal that requires our attention. I'm sure you all have heard it put like that. Pain is an amazing, wonderful part of our system. It alerts us that something needs attention. And unfortunately, for the most part in the medical community for the last few decades, if not longer, has been wanting to suppress the pain, ignore the pain, put a Band-Aid on it, give it a pill. And what hypnotherapists, more than any other field, I believe, and from all the research I've been reading, says that we have been able to uncover beneath the surface what is the actual cause of the pain. And again, physical, emotional, mental, energetic, whatever words you want to put on it, everything affects everything, like I said a little while ago. And it's going to, if you have a signal that is perceived as a physical pain to the client, there is something underlying it that needs to be respected and have attention. And there are ways that we can do that, I believe, that are far more advanced and in-depth than what a lot of the medical community does, or what they have the time to do or the training to do. Each one has their own specialty, of course. So hypnosis can be a valuable adjunct technique to help the client relieve pain. At the beginning, I think most of you know this, in most states, if not all, and countries, hypnotherapy for pain, you want to get that medical referral. If someone calls me or comes to me for pain, or a hypnotherapist, well, even if you are licensed in some other thing, unless it's in a field that deals with pain, obviously, then you're going to want them to get checked out. You want them to be evaluated by the appropriate licensed medical professional. So I just want to make sure I got that part in too. Okay, so adjunct technique. Many times we can help the person achieve permanent relief instead of, just taking pills and covering up the symptoms. So here's a Dr. Spiegel quote here. Hypnosis is the oldest Western conception of a psychotherapy. This is said by NIH grantee, Dr. David Spiegel. Hopefully you're familiar with him. If not, he has a wealth of wonderful information and videos on YouTube. In a recent NCCIH Integrative Medicine Research lecture, he said it's the first time a talking interaction was thought to have therapeutic potential, meaning hypnosis. It's useful as a model system for understanding how brain-body interactions work. I love David Spiegel most of all as a ambassador for our field, because he got interested in and fell in love with hypnotherapy by wanting to prove that it was useless, that it was fake. And those are our best ambassadors, because he went out to do extensive research on the Simonton studies in the 1970s. Now, Spiegel and the Simontons, when I started 33 years ago, I was lucky enough to stumble into a place in California where they were on the list of presenters. I didn't know who they were at the time, but he wanted to prove that those Simonton studies of the 1970s, where they had them Pac-Men eating the cancerous tumors, that might sound familiar to you. He wanted to prove that that was baloney, even though it was doctors that actually did the studies. And in his extensive, really extensive studies, he became an absolute believer. And now he talks about hypnotherapy, and he has a great appreciation for it. So he's a great advocate for us. Techniques for pain relief. You might ask yourself, and you may know some or all of these, and maybe some additional ones, and I'd love to hear them. One of the easiest things that I teach in my trainings is objectifying pain. You may have a different name that your trainer or that you've studied that calls it. If someone is coming into my office for pain relief and they are in immediate pain right now, the first thing we want to do is do something to get them relaxed enough and comfortable enough that we can work with them. Do you ever try to hypnotize someone who's in pain? There are some ways to instantly do that, and we'll talk about a couple of those techniques in a minute. But objectifying pain is something you can do within 5 minutes, maybe a little less, maybe a little more. And you can get a pain, a degree of pain down, to my experience, within 5 to 7, 8 minutes. Usually from 70%, you can get it down to 20% or less. And many times it's not even noticeable. And that's pretty important. Now you can do hypnosis with this person. You can have a decent interview. So I love objectifying pain. I have a script that I use that I put together, and it's maybe similar to what you learned. I kind of do it my own way, so I can send that to you all as well. Anything that you want me to send you of the handouts and of the extra materials, you can email me at uphypnosis@yahoo.com. Up, like look up in the air, hypnosis@yahoo.com. And I'll be happy to send you whatever materials I have. Techniques for pain relief, metaphors. Pain relief, whether it's chronic pain, whether it's actually for any medical issue, metaphors have been shown in most studies that have been done to work the best, and in my experience. And there's a reason for that, because metaphors bypass that critical faculty, as we say, and get straight into the emotional center of the mind. That I call it unconscious. You may use the term subconscious, whatever your name is for that which is outside of our conscious awareness. Just know that that's what I mean when I say unconscious. So metaphors go directly to the unconscious and engage our creative imagination, storytelling, those kind of things. And the person is in, and what that does, one of the things it does is one of the techniques down here, it disassociates them from their current experience. And with, of course, if they're having some kind of pain, that's a good thing. So metaphors are beautiful to use for pain management. Parts therapy, if you're familiar with parts therapy, I'm also a trainer for the Tebbets Parts Therapy Foundation. I teach parts therapy and always have in all of my trainings through the years, because I learned it, I think the first year I was in the field, and then learned it a whole bunch more times from a bunch of other people. It's a beautiful type of process. Muscular relaxation. We all know how to do progressive relaxation, some variation of muscular relaxation with our clients. That alone relieves pain. Isn't that wonderful? Breathing. Some hypnotists more than others use some types of breathing processes with their clients, maybe in the pre-talk, maybe teaching them things to do on their own. It is also a quick way, if somebody's having acute pain, it's one of the ones that's very fast. Getting them focused, because remember, hypnosis is about focus. The starting point for hypnosis is focus. And then you amplify that little focus trance by adding more detail, by getting them involved. Involvement creates trance. So breathing is a quick way to get their focus on something. Distraction techniques. Distract them. If they have a pain in their head, get their focus on their big toe on their left foot. Anything else that they can really focus on, again, dissociates them from that part of the body that's in distress. And quickly, I did this with my mother one time when she was still alive. She came to visit and she banged her arm on the corner of a counter and she bruised really easily. She was in her late 70s at the time. And she just let out a scream. And she had hit her, I guess what we call it, the funny bone. It's not very funny, but I knew she bruised real easily. And I just went over to her and I said, Mom, I just learned this new thing. And I got her attention real fast and started talking fast. And her eyes just got real big. And I just made something up. I said, I'm pulling it out. I'm pulling it out. I'm pulling it out. And I kept throwing it away, pulling it out. I just made it up. And before I know it, after about 20 seconds of doing that, she's staring at me in trance. And she says, what did you just do? And I said, why? She says, it doesn't hurt. I was like, cool. You know, if you think of something and you can distract them and be positive, when it's quick like that, it will work. And she didn't bruise. That was the part I was amazed. She was here for a few days and it never bruised. It was really wild. Okay, distraction, dissociation, again, getting them away from the source of the pain. That's what we do, isn't it? We don't have them dwell in their misery, whatever it is. We help them to find comfort. Reassign the pain, like I said. Now, some people say put the pain in your head, in your toe, or something like that. I don't know about putting the pain somewhere on the person's body. That doesn't resonate with me. If it works and you like it, it might have some nice effects. I personally, reassigning the pain to put it someplace completely not on their body, or reassign the pain to have some other kind of expression, like turn that pain into heat. Let the pain, if you say make it cold, cool, soothing, it might not. That's a big leap. But if you just say, if you're talking the person through, it might take, this takes a little longer. If you're talking the person through, focusing on the pain and having it slowly, gradually turn a color. Find out what color it is, have it change to color, or have it change to warmth. And then from warmth, maybe you can go to coolness, or maybe you can go to something else. So it's, again, reassigning it, which is really just, again, dissociation and all of that. You can use, one way to dissociate is to have them imagine a TV screen and they can see themselves on the screen or in a mirror. Now they're not, the idea is you're disconnecting them from the emotional impact of that pain, which evidently is the biggest part of it, of the experience. The library technique, some of you may be familiar with. I studied with Dr. Michael Preston in Arizona, and he created something called the library technique. There's a lot of other ones out there, but he really refined it and did books on it. And he wrote a book called Hypnosis, Medicine of the Mind. I studied a lot with him for the medical. And the library technique is a nice one. If you want something on that, I can send you that if you're not familiar with it. Glove anesthesia. I'm sure those of you that are hypnotists have learned glove anesthesia. It's not my favorite way to work with anesthesia, and I've done lots of dental work with no anesthesia. I've done a couple of surgeries now with no anesthesia because I just had cataract surgery. So I had eye surgery with no anesthesia, and a few years ago I had periodontal surgery with no anesthesia. So I prefer some other methods, but if you do know glove anesthesia, it's a way to desensitize, however you do it, or to anesthetize the part of the body that's having that discomfort. Humor. I hope you all use humor with your clients. If someone is in discomfort, in pain, in their words, when they walk in, if you can get them laughing, laughter is a great pain reliever. It releases endorphins and all those big named chemicals in the body that the doctors know. It releases all of those and helps them to feel better. So use any or all of these things that you can. Again, metaphors have been shown to be particularly effective with medical issues and chronic pain. It's with any kind of pain, but chronic pain especially. There's a thing called the alarm clock. Just the basic idea is you have your client imagine there's an alarm clock in their head. Remember, it's a signal, and the signal wakes you up not just when you're sleeping, right? During the day. The signal wakes you up, but you can teach your client how to hit snooze. So the signal amplifies the experience of pain, and you can give them tools to help them metaphorically to quiet that signal. And guess what happens? I don't have to tell you. A healing room, the idea, the metaphor of a healing room, or I like to do a thing where they go into a beautiful meeting place and someone special is there and they end up meeting their inner healer and getting all of their description of what does this inner healer, how does it appear to you? How do you imagine this inner healer, and get their imagination involved. Again, the more you get their imagination involved in any process, it deepens the trance. It amplifies the experience of hypnosis. So you always want to do that. Sacred space for healing. Again, language-wise, you want to know your client and what they're open to hear. You don't want to start talking about angels or spirit or those things unless you've already done an interview and you know that they're open and that those are positive types of words for them. Again, we get the words from our clients anyway, hopefully. That's ideally. So a sacred space for healing. Most people are pretty okay with that kind of an idea, and you can create it in, there's as many ways as there are people and imaginations out there. The control room for pain relief. Have them go into the control room in their mind. The simple idea is there's all kinds of levers and dials and all kinds of stuff in there, and they can start manipulating those things that have in the past been adding to their discomfort. Now, when the client comes in, I recommend, if you don't already do this, step into their world and talk about their pain. Let them talk about their pain. That's their current trance. That's what their reality. That's what they're experiencing. Very quickly, once you have really good rapport with your client, I recommend, if you don't already know this, to stop saying the word pain and change it to the word discomfort, with the emphasis on comfort, because studies show that when in the hospital room, when the doctor or nurse walk in and say, "How is your pain?" because they have to say that, the experience of pain instantly increases. So in our office, we want to quickly, once we have rapport and they feel listened to and heard and respected, now we can start reframing that into discomfort. So their mind keeps hearing that word comfort, comfort, comfort. So there's a comfort dial, right? The comfort dial, an imaginary dial in their head that they can turn down the other signal and turn up the comfort signal. There's a lot of things you can do with water, with like a waterfall, a healing waterfall, or getting into soothing, cooling waters in a stream. Water seems to be a very comforting thing for most people. Again, you want to check out your client, make sure that it is for them. Soothing waters can be a nice metaphor. White light for comfort, or some kind of nice healing light energy. Again, adjust your language for your client. The best metaphors, of course, are the ones they give you in the pre-talk. You elicit the metaphors from your client by asking questions and really listening to them, because they already have them. Everyone has their internal representation at the unconscious creative mind level for what comforts them. And you can turn their personal internal representation for comfort into a nice metaphor that you can use in the hypnosis session, and you can teach them to use between sessions. Now they're getting all of these ideas that empower them, because isn't that nice? That's what we do. We help empower our clients. So the difference with hypnotherapy, very simple, is we take them from that pain and we gradually and very gently and nicely in our session move them to comfort, and then we can anchor it. We can teach them techniques to bring it back and to get them to where they actually can create it for themselves. So with us, all the focus is on moving toward comfort. We can uncover the true source of the pain and do whatever healing or clearing work we know to do in those sessions that empower the client with strategies and techniques to give themselves relief when they're not with us. So that's just a little quick bullet point thing I wanted to show you. Any comments or any input that someone would like to share at this point before I move on? You're all so polite and quiet. You can jump in, you know. We're all here to learn from each other. That's why I'm here. I'm a baby student still wanting to learn more and more and more.
I
Okay.
have one.
Yeah, Valeria.
And I think you mentioned that you might have some material about this, but can you just briefly describe the library technique?
Oh, wow. The library technique is pretty complex. So I'll send you a handout on it if you email me. But basically, the whole idea of it is the meat of it is to go into a metaphorical library. Most people still know what a library is, you know, with rows of books and things. And the books that are on one side of the library represent every positive, happy moment in the person's life. And on the other side are all of the problem books. And the main problem book that he starts with is always the actual problem. So if it's migraine, for instance, the first book coming off the shelf is going to be the migraine problem. He has them hold the problem. Then now all of a sudden it's not a book, it's a problem. And he has them tear out pages and there's a lot of hypnotic language talking them through feeling wonderful that you are ridding yourself of this problem. It's just it's a way to clear out the clutter of whatever, and then it goes to the I can'ts and to the doubts or fears. All these different books have names of things that are contributing to them having their chronic pain, if that's the problem, right? So there's going to be things we uncover in the pre-talk, like fear, like limiting beliefs. You know, maybe the doctors or somebody has convinced them that they're going to have to be on medications the rest of their life. And by the way, we don't say anything about that if we're not a medical doctor. Don't say a word. If the client says they talk to their doctor and they're working with their doctor to get off medications, I throw a party in my head because that makes me very happy. Now I have permission, and I make sure the doctor's on board to help along with the doctor as adjunct hypnosis referral, that I can help them, the doctor, to get them to the point where they can possibly start to lessen the meds and maybe eventually get off them, only if the doctor decides it's the right thing to do, because that's outside of my scope of practice. So just be very aware of scope of practice when you're doing these things. Well, did I answer your question about the library? It's
Yes,
so
yeah,
long.
thank
It would take a couple hours to explain it fully, but it's a beautiful way to clean out. It's like any hypnosis process. Think about what we do. Everything has a history. If they're coming for pain, and definitely chronic pain, it has a long history if it's chronic pain usually, right? So we know that we're going to be doing some kind of something that deals with the past, either some regression work or a timeline or something. It's always going to deal with something that happened before they walked in our office. That's part of and that's what the library does. It deals with it in the way of these past books and doubts and fears that have been developed around the problem. And then we clear that up in whatever's ready for that session. Then we bring whatever they learned from that or whatever adjustments their mind was ready for that day back to now. And then we future pace, right? We take the change out into the future. That's kind of general to any process we do with a client during a session. So if you keep it to the basics and you just use some of these ideas to fill in those spaces, whatever you say that's designed to help your client get where they want to be is going to be very, very helpful. The good thing about medical, the thing I loved about it instantly, because I was a little bit afraid of it at first, but my ex-husband had lymphoma and I went to support him and I fell in love with it right away. With pain especially, but with any medical issue, but with pain, you can instantly give them relief. And along with that relief, a big part of it is you can give them hope. You can give them some kind of hope that they actually can feel better, right? Now, we can't make promises or make guarantees. Please don't do that. But it's wonderful to be able to give them hope. I have a very long, beautiful article I found that I think has enough stuff for any of you that would like to really do more research on this. And like I said, any of the things I mentioned you'd like more on, I have so much in my database on everything. I'm sure I could find something for you. Oh, I have this nice little thing I developed during a medical hypnosis training a few years ago. I came up with this idea. And it's called the Healing Circle Triad. I did it at the conference a few years ago. It's a beautiful little piece. It's really nice for people who have a belief in either a higher power or spirit or, sacred type, things, not religious necessarily, but, you can bring that in if that's their belief system. But again, step into their world. But this is a really beautiful one because it takes them through from now to where they have access to more. The implication being whatever they believe in, they have access to something beyond themselves, which is a nice freeing up of their faculties for a lot of people, and then realigning with that incorporated and then bringing it back to now. So again, it's a circle triad that when they get back to now, it talks them through it. I can send this to you if you like, what each circle does. It's nice to do in person. I did it, with a demo person in person, but I have done this online and it works. It works because in their imagination, they can step through it the same. I kind of like walking through it with somebody, but you can do it online as well, because the client's the one that's doing it in their mind anyway. So that's a nice little piece that you might like. Well, let me show you this quick piece first. I'm sorry I'm moving so fast, but there's so much I'd like to show you everything I have. National Institutes of Health, right? Great resource for all of you to go to do research on all this stuff. Johns Hopkins, Mayo Clinic, all of them have things on hypnotherapy now for pain. This is a nice little article that they did, 6 tips, IBS and complementary health practices. It says 1 in 5 Americans have symptoms of IBS. If you didn't know that, and chronic pain is almost that many. I think I saw a thing recently, 1 in 8 or 9, I think it was, Americans have chronic pain. Or that might have been the guy in Australia. Anyway, that's probably universal worldwide. The 6 tips that the National Institutes of Health showed for chronic pain, for IBS in this case, the first thing on their list, the first tip they gave was for hypnotherapy. That's a good thing. That's a big change from 20 years ago or 30 years ago, right? Says it talks a little bit about it. Power suggestion, trained hypnotist, hypnotherapist, deep relaxation, most widely used mind and body intervention for IBS. Did you know that? I'll bet you didn't know that. It's nice to know. Several studies of hypnotherapy for IBS have shown substantial long-term improvement of gastrointestinal symptoms. They don't use the word substantial unless it's big. This is a medical journal, right? So that you can show this to clients. You can show it to doctors if you want to, be a partner with them and get referrals. So substantial long-term improvement, as well as anxiety, depression, disability, and quality of life for those people. So that tells you can help with all those things are related to most medical conditions, aren't they? They're good. Everything is affecting everything else. So then it gets into some things on chronic pain and all these people that have these problems. You'll never run out of customers, clients in this field, let me tell you. There can't be enough of us out there. But this article is really cool now that I've finally got that out of the way. Let me pull it up. I love it. This one caught my attention because of the name of the article. The name of the article is Pain is Weird. I don't know. I thought that was funny. I like the word weird. To me, weird is a good word. Hypnosis is weird, isn't it? I mean, to some people. Anyway, I don't want to read this to you. I've got a few things highlighted, but I will send this to you. This comes from, you can look it up yourself if you want, painscience.com. I kind of did a synopsis and then I put some more comments at the end. If you like this with the highlighting and everything, it's complex now. The way that they're teaching it, but now this is pretty recent. The science is clear now. This is fairly recent. Like I said, every painful sensation is 100% brain made. There is no pain without the brain. So, and it goes through some things here. This Dr. Laura Moore Mosley has a really nice some additional connecting articles to this one that you can find. Talks about pain is an opinion. You know, I have my article, like I said, pain is a behavior. I worked with a gentleman who one time where he said, yeah, every day about 6:30, it shows up and gets worse. It's like, really, every day at 6:30. So a nice question to ask people that say things like that, you know, because we want to reframe. And I said, was there, I said, you know, I'm curious. That's really interesting that it knows to show up at that time every day. Was there ever a time when 6:30 came and it forgot to show up? I just asked that very curious, like, right? And his face got kind of funny. And he said, that's interesting that you asked that, because a couple weeks ago, some friends of ours came into town that we hadn't seen in a long time, dear friends. And we went out to dinner with them and had the nicest evening and got home and had the nicest visit with them. And the next day I realized the pain didn't show up that night. So now you've got your client realizing this. So when we say it's a behavior or opinion, or you can actually condition it in, and some of the things that were on that other article, and it's in here too, talks about people's expectations, right? They start to create it with their expectations sometimes. So everybody knows about phantom leg syndrome, right? Where people have pain in a limb that's gone. And this gentleman, Ramachandran, I'm not sure if I'm saying that right, he got an idea to use mirrors long time ago. And he would use mirrors so that it looked like they had both arms or both legs or whatever it was, and started working with people and started getting a lot of great, results with people. The mirror cure, they called it, of phantom limb syndrome pain. And everybody was kind of curious about that. And now they, of course, as they're used variations of that, they found out something that I'm sure you won't find surprising, that they found out it even works without the mirror, right? Because the person's imagination has that power. So there's a lot of good things in here that I will send to you. Like I said, we don't have time to read all this, but there's some really interesting examples of someone. Oh, there was one where a worker got a pain or got a nail through his boot and was having excruciating pain. And when he got to the doctor's office and they removed the boot, they found out the nail had actually gone between his toes and he had absolutely no injury to his foot. So now that's called a nocebo, right? Where there really shouldn't, ideally there wasn't tissue damage, and this person felt it because the brain interpreted the signal and thought it was injury. Okay. Anyway, this has got some really good stuff in it. The signals of pain and red alerts, and the nerves, talking to the nerves, having a conversation with your nerves. This is a three-legged cat named Isaac trying to scratch himself with his missing leg. Conditioned response in our mind, right? And a little caption there. Now, a little to the left. So the mind is that powerful, right? If the pain believes there's a threat, you're going to hurt no matter how pointless it is or how intensely you focus on trying to have more reasonable, rational sensations, right? It's how the mind interprets the signal. Sometimes there is no tissue damage at all. And with chronic pain, that is very often the case. People are having pain way after the tissue has healed a long time ago. So they talk about, if I woke up in the morning and nothing hurt, I'd think I was dead. But anyway, there's some good stuff in here. So I can send you this article. I added some things at the bottom of this. And you have, like I said, the connection, how you can read this online. But this is a part of the article. The central nervous system responds to vivid, emotionally driven imagery, imaginary experiences, the same as it does to real ones. So if your client is vividly imagining something and there's a lot of emotion behind it, you can get some of the same, responses from the body, from the central nervous system. Medical hypnotherapy, again, it's getting much more popular. They're becoming part of the team. The medical team they know now needs to include something that addresses the emotional, the mental, along with the physical and all of that. So we are the people that are the best trained in how to talk to the person's creative unconscious mind. And psychology and some of those other fields are catching up. When I go to the websites these days, they're incorporating a lot of neurolinguistics, NLP, and which came out of hypnosis in great part. And they're incorporating things that hypnotists have been doing for a long time. And that's a good thing because they're realizing it actually works and has more permanent results. Dan Cleary's here. Dan, you introduce yourself briefly. We're almost done. You got here late.
Well, there you go. I'm Dan Cleary. What more should I say?
You're the pain expert. Dan Cleary has written a book called Targeting Pain. What else have you written? A bunch of books.
Yeah, well,
I've learned a lot from him through the years. There you go.
Little book.
The little book.
Those basically are it. I had Changing Pain, which was also a little book, but they're both out of print. So Targeting is still available.
We've only got like 5 minutes left. Unfortunately, you got here kind of late, but I did want to introduce you. So you'll have to look up Dan Cleary in other ways, but he is an expert on pain that has lived the life that gives him the ability to be an expert on pain. That it's a great story that if you ever take any of his seminars, you can hear his beautiful story about, well, probably not beautiful to him in the beginning, but what made him the pain expert is quite phenomenal, actually. And like I said, I've known you probably as long as I've been in the field for 30 something years. And I've learned so much from him. So if you ever get a chance to do a seminar with Dan Cleary, I would highly recommend it. So anybody have a question about what we have covered here? I know there was more I wanted to cover, but wow, an hour goes fast. Any comments, anything you'd like me to expand on?
I just wanted to make sure that I got your email correct.
Yeah, up hypnosis at yahoo.com.
Okay, thank you.
Up hypnosis. So if you email me, I will send you all the things I mentioned because I have it written down. Yeah, Anne.
How do you get a doctor to write a script to have you do the pain therapy? I can't get it out. How do you talk a doctor into doing that?
Well, I don't really talk the doctor into doing it. Generally, the client does.
That's what I mean. How do I talk them into it?
Yeah. Most doctors nowadays, it's pretty easy. I mean, I've been getting referrals from doctors for 33 years since I've been doing this, but you can take them articles if they're not familiar. I mean, most of them are nowadays. They know that hypnotherapy is a good adjunct therapy, and we're working with the doctor, not instead of, and it's their patient. It's our client. Unless you're a licensed medical person, then you have different language you can use. But my scope of practice and most hypnotherapists, it's our client, and we are an adjunct. We're complementary. Integrative medicine is my favorite term nowadays. We're part of the medical team, just like a chiropractor would be, or just like some other, specialist that your doctor refers to. And most of my clients, if they call me and they don't have the referral and I tell them they need it, they go to their doctor. They say, I want to go see a hypnotist for this. Most doctors want to give their patients what they want, whether it's an MRI, whether it's medicine. They want you to be happy. I've only had a couple times through the years when the doctor wouldn't do it out of all. And most of my clients are medical referrals. And the couple of times they wouldn't do it, the person wasn't happy with the doctor to begin with. And they called me and said, I really wasn't happy and I've changed doctors and now I have my referral from my new doctor. And of course, I don't say anything. We can't say, anything about any of that. But it's nice that they already, most doctors, like I said, they want their patient to get what they want. And if it's appropriate, and if they don't know what we do, I believe it's our job, all of us here that are hypnotherapists, it's our job to educate the medical community, get out there and educate them. And if you're seeing people online, I still want to get that referral. I will accept these days, because we do so much online, I will accept an email from the medical clinic or the doctor saying they they say it's okay for their patient so-and-so to use hypnotherapy for whatever their ailment is. They don't even have to have my name on it, frankly. It's just so the doctor approves of them and knows that they're using hypnotherapy for whatever they're treating them for. And does that answer your question, Ann? I can give you some articles.
sure
Doctors
does.
don't have time to read them.
In
You
other
know,
words,
maybe the
just ask
maybe the
and hope he
assistant would read it.
understands or she understands.
Yeah. Usually the assistant would take the time maybe to look at something you bring in, and they'll convince the doctor. So look, she really wants to see this person, and this person, you know, give him your bio. You know, I give them my bio and just a little write up or something. The doctors don't have time to look at it. Like I said, they just want you to be happy usually. If you're not happy, then you probably don't stay with that doctor very long anyway. At least that's been my experience. So it's not a problem. The only people that I hear, I go to conferences for 30 whatever years, the only people I hear complaining they can't get doctors or people, and I hear them say this every now and then, people in my town or my area, they won't refer to hypnotherapists. Doctors in my area won't refer to a hypnotist. And I feel like that's their limiting belief. They need to do some self-hypnosis on that. Because I usually, when they tell me that, I'll look up all kinds of hypnotists I know in their area that are getting doctors referrals all the time. So think about how you think about it and then find a solution. That's what we do as hypnotists, right? We don't look at the problem. We look at how can we find an outcome, a solution, a positive resolution or whatever. That's what makes us different. We're always focused on, you know, where we want to help the client get, because that's what they're asking us to help them with. Oh my goodness. That's Stephanie. Is that Stephanie? Oh, we're just finishing up.
Oh
no. Did you
no.
get the wrong time?
I did.
I'll send you the video. I'll send you the
I got
replay.
Oh, hi, Tony. I was in the East Coast when I got the message. I bet my computer can convert properly.
Really?
Oh, yes.
Yeah, it's 7:30 to 8:30 Eastern US and Canada. Stephanie, introduce yourself though. I'd love for you to just say who you are and where you're from.
Yeah, I'm Stephanie Stevens. I'm from Minneapolis, Minnesota. And Tony and I got to train together. So I was looking forward to this, but I'll be sure to watch the recording.
Yeah, I'm so sorry you missed it, but I've got a lot of handouts and, you know, in an hour, what can you do with pain in an hour? You know, you can do a lot with it with your client in just a short amount of time. Yeah, exactly. Yeah. Dan Cleary's smiling. You knew what I meant though. As far as teaching it, it's not that different from other things that you do. If you're not working with pain, I highly encourage you to know that if you're a trained hypnotherapist, I'm positive you have the skills to adapt it to pain relief. And it's one of the easier things that we do. It's one of the easier things. Now, that doesn't mean everybody comes to us is going to, you know, be successful or to have 100%, you know, where they want to be. But we can always help them feel better. We can always help them feel better if they're walking into our office with a referral. That's my belief anyway. I haven't found anyone yet that came to me for pain relief that didn't have some positive results, and usually way beyond what they expected in the first session. Because the mind works, their mind works, doesn't it, Dan?
Well, sometimes.
Sometimes. As we get older, I question it every now and then.
If mine worked better, I would have been on time.
And it's so nice seeing all these wonderful familiar faces and a few new ones. Thank you so much. Great to see you all. And I hope to see you all again. And I'll see some of you next month in Orlando, I hope.
Thank you, Patty. Thank you so much.
Thank
you.
Thank you.
Thank you.
Take care.
Thank you.
Bye-bye.
Thanks, Patty.
Thank you.
Thank you.
Bye-bye.